Yesterday, the Department of Public Health reported 1,800 new COVID-19 cases in Massachusetts. About 86,000 molecular tests were reported. In total, over 20 million tests have been conducted here in Massachusetts. In Worcester, here at the Family Health Center, we've been very appreciative of the work they've done to get community members access to testing throughout the test site that's been located here since last spring. And even as we distribute vaccines, and I can't make this point enough, testing continues to remain a critical part of how we fight COVID. It helps us and helps you, the public and individuals, identify cases, work on isolation, find ways to support people as they deal with COVID in their own particular circumstances, and trace positive cases so that we can continue to slow the spread. I'm pleased to say that we remain a national leader with respect to our testing output. Since the start of the pandemic, Massachusetts has completed more COVID tests per capita than virtually every other state in the country. And our testing continues to be relatively high relative to where it was back at the end of last year. And I want to thank the team here in Worcester for being part of that testing success. With respect to the rest of our metrics, about 698 patients are in the hospital for COVID and 172 are in the ICU. We've seen hospitalizations drop by about 10% since the beginning of March and report between roughly 1,000 and 2,000 new cases of COVID each day for the past several weeks. New cases have declined a little bit over the course of the past few days. On vaccines, over 4.5 million total doses have been administered to people across the Commonwealth, and more than 1.7 million people in Massachusetts are now fully vaccinated. We remain one of the top vaccine performers in the country on almost every key national metric, and we are the top state in both first and total doses administered among states that have more than 5 million people. We were also the first state with at least 5 million people to deliver a dose to over half our entire adult population. And I fully expect that at some point later this week, what do you think? We'll pass 2 million people in Massachusetts fully vaccinated.
We will this week.
We will this week.
You heard it.
You heard it right there. Center of gravity spoke. And we continue to lead all states with more than 5 million people when it comes to our percentage of our adult population that's gotten a first dose with 53%, and we're fifth among all states for the percent of the adult population that's had a first dose. And as I've said many times, and I will continue to say, we have the infrastructure to administer a lot more vaccine than we've actually got. But unfortunately, we've been told by the federal government that shipments, especially with respect to the J&J vaccine, will be much lower this week after we received a one-time increase last week. We continue to hope that the federal government's increases with regard to vaccine supply generally, and especially with respect to J&J, get resolved, and that the supply numbers, not just here in Massachusetts, but around the rest of the country, get to the point where they can actually meet demand. And when they do, we will quickly be able to get those doses into people's arms, as we have been for the past month or so. 1 week from today, on April 19th, Patriots Day, we'll open vaccine eligibility to everybody, providing vaccine access to all individuals 16 and older who live, work, or study here in Massachusetts. I want to start this by saying how grateful we are that so many eligible residents in Massachusetts have signed up and gotten vaccinated so far. And we would encourage everybody who will be eligible to sign up and schedule a vaccine when they are eligible. The vaccine saves lives. And if there's any doubt in anybody's mind about that, they should take a look at the success that vaccinating older Americans has had on older American case counts and older American hospitalizations. They have plunged dramatically since we began vaccinating senior citizens here in the U.S. back at the end of December. Our pre-registration system connects to hundreds of thousands of people with appointments at mass vac sites and also some regional collaborative sites, and there'll be more regional collaborative sites and others to be added throughout the month. That's in addition to the hundreds of other sites that exist across the Commonwealth, including community health centers in every region of Massachusetts like this one here, and so many of the other folks who are helping us deliver vaccines in disproportionately affected communities. Throughout the pandemic, our administrations worked closely with community health centers to both support them on their testing initiatives as well as on their care delivery initiatives and to help keep their communities safe and healthy. These places not only know the neighborhoods they serve, their neighbors know them. They are trusted by the residents in their community, and they often play a key role in getting vulnerable communities access to care. In total, community health centers here in Massachusetts have administered over 300,000 doses, making them one of the top 5 types of providers here in the Commonwealth. The federal government's also recognized the importance of community health centers, and they've continued to increase the number of doses that they make available to these organizations week over week. And as we move through the vaccine rollout, community health centers are going to continue to play a critical role in vaccinating both their patients and other residents in their coverage areas. Family Health Center here in Worcester has been vaccinating their patients for the past several weeks, and soon they'll begin to vaccinate the broader community as well as supply increases, because supply is going to increase. They've also played, our community health center partners, critical roles making connections between larger hospital systems and smaller community and faith-based organizations in their neighborhoods. And that's made a big difference with respect to both outreach, understanding, and delivery of vaccines across many communities in Massachusetts. And like many aspects of COVID, vaccine storage is a challenging issue, especially for some of the smaller community-based healthcare providers. That's why at the beginning of the process, we established a reimbursement rate for vaccines that was significantly higher for vaccines than it was at the national level under the Medicare rate to make it possible for community health centers and others to administer the vaccine to their most vulnerable populations. And we're pleased and proud that from the beginning, Massachusetts was focused on making it possible for these neighborhood-based providers to administer vaccine to members in their community. Community health centers also play a key role to make sure that people have access to insurance coverage. The Family Health Center here in Worcester is one of hundreds of community-based organizations across the Commonwealth that work with the Health Connectors Navigator program to get residents in their neighborhoods insured. Though insurance isn't necessary to get the COVID vaccine, it certainly makes a difference with respect to all other aspects associated with health care. And we're proud that Massachusetts has one of the highest insurance rates in the country. I can't imagine anybody's got a higher one, Professor, at 97% of our residents covered. The access to health insurance here makes our communities and our families healthier and ensures everyone can access the care they need when they need it. As I said in my opening remarks, today is the 15th year anniversary of the passage of the health care reform bill here in the Commonwealth. The law made Massachusetts a national leader in ensuring access to health insurance and has helped sustain us as one of the healthiest states in the nation ever since. It created the Health Connector, which has played a key role in helping people sign up for quality, affordable health care coverage. And we're here today with Secretary Sutters and Health Connector Executive Director Luis Gutierrez to share some reminders about the Health Connector's work to get people covered and to keep them covered. And I also want to say, I remember working with then State Representative John McDonough, who's standing over here to the side, on what I would describe as the screen pass that got us within the goal line, or close to the goal line, associated with getting everybody covered back in the mid-1990s. And it made it, I think, a lot easier to get the final leg of that process accomplished several years later. And John, you were a real architect of many of the most important pieces associated with access here in the Commonwealth. I'm not exactly sure why you're here with us today. I'm thrilled that you are.
Louis invited me.
Did you? Good for you, Louis. Okay. And I just want to say how much we appreciate all the work you've done and the sort of blending together of just real serious smarts about this stuff with an ability to understand politically how it all plays out. And I really enjoyed the time I spent working with you way back in the day, in the 1990s. Let me close with, by the way, I also want to give Louis a big high five. He walked into a pretty difficult situation at the Health Connector when we took office back in 2015. And he not only dealt with it, he dealt with it in a relatively short period of time. There weren't a heck of a lot of hiccups along the way. And this connector here in Massachusetts, I would argue, is among the most successful, if not the most successful, in providing access to coverage for people here in the Commonwealth. And that's been borne out by the number of people who've accessed coverage through the connector and stayed there because they really liked and enjoyed the products that they had over the course of the past several years. I do think we will at some point emerge from the pandemic and look ahead, and we'll continue to prioritize efforts to build healthier communities. But we will start with, in many respects, one of the healthiest community-based care delivery systems you're going to find anywhere in the country. Not only do we have some of the best hospitals in the world, which we talk about a lot, we're incredibly lucky to have a really strong network of community-based providers like this one here in Worcester and around the rest of the Commonwealth who are on the front lines every day, solving problems, helping neighbors, and making sure that Massachusetts does live up to the commitment we made to make sure everybody in Massachusetts has access to health care.